All right. Today topic might not take the full 2 hours, but we'll see how it goes. But it's something that we need to be aware of. Even if we think we are aware of, maybe sometimes we're not exactly. This will also help you work with not only with the patients, but also with the healthcare providers. Because technically they should educate you how to proceed with in those settings in a cultural competence and how to provide that interpretation to not get to cooperate with the patient, but I'm pretty sure they don't even know that. So again, everything on your shoulders, and you will need to educate also them as well, especially WCB case managers and all those life marks and CBIs and Millard Healths, you name it, they need that from you. Okay, so let's start it. Now, what is going on today and what are we going to talk about? So, cultural competence in medical interpreting. You're not always translating words in this case. So, I mean, well, you still do, but go back to the Thursday session when we were talking about this imagination and how to create the picture and then that visuals. So here you're going for meaning of the words and the context of these words, right? So again, well, accuracy will be here important as always. That's something that will stay with us forever. But you need to also kind of be that person that will deliver the same meaning, the context, the way how the patient want to talk, that sensitivity. We have to also respect a lot of different boundaries. We also have to respect whatever is coming from different countries, beliefs, values, traditions. So there's a little bit into this whole thing, but I will try to separate it a little bit so it's gonna have a little bit more sense. All right, where is my slide? There you go. So cultural mediation in healthcare, basically, it's a quiet, but one of those kind of like the powerful things that you need to focus on. So if you're going to proceed with the good cultural competency, the cultural mediation, the patient experience will be different and the outcomes will be different. So mediation is kind of like still you're linking those interpretation itself and how everything works based on the other aspects, but here you're kind of linking the cultural difference. And since you, as a representative of the country, mostly for the same as the patient, that's where I'm saying that you kind of need to be that link between their approach and let's say a Canadian Western doctor approach, right? Because those are two different kind of, we can say words. Yeah, probably two different worlds, kind of. And not always the doctor can understand what the patient want to say, and not always patient can understand what the doctor wants to say. So in that case, you are linking those cultural differences between the patient and that healthcare provider. So after that, there is a little bit that understanding is a little bit more clear. There is a kind of like a mutual respect for each other between them. Um, and the patient is also willing to cooperate a little bit more. So it's not now just words and the actual interpretation, but here, yes, you are going for the meaning, the context, and like the expectations from the both parties. So you need to, whenever on Thursday we were talking about creating a movie, well, now here you need to hop in that role where you kind of feel the same thing as the patient, if that makes sense. So your extension of that imagination, what was happening when you were creating the movie, but here now you are the extension of the actors playing in that movie. If they're gonna feel that pain, you probably most of the time, but not always, but most of the time, you might understand the pain they're talking about. Maybe you had that pain. Maybe you were sick for the same thing. So you'll be more focused now on that context and meaning of the actual words, because let's say if there is a word that doesn't exist in either your language or English, now you can actually explain it your own words. You can describe that. And then we have the meaning of what the patient wants to say. So that's something that then when you are, we can say you're going like kind of a little bit beyond just simple interpretation, word to word. There might be some misunderstandings culturally affected as well between healthcare providers and patients. So that you are also there to help understand maybe the healthcare providers what the patient actually want to say. Because now you are also the person that understand the patient's values, their expectations. Probably you were many times at the doctor, places, clinics, or any healthcare providers in your own country when you were younger, older, and you know how you want to describe things, their beliefs. That's something that also can be explained to the healthcare providers. So the patient eventually will feel safe and feel comfortable and will be open for the dialogue with the healthcare provider. There is that kind of trust thing that can happen as well. So when you will explain that, and also you will explain from the other perspective of the healthcare providers to the patient situation, that's where the kind of like the intention of the healthcare providers and the recommendations will kind of align with the situation and expectations from the patient in that case. So you are not only now just the interpreter, you are now, that's where you can say you are that mediator to help them communicate on the kind of higher level, we can say, right? So the key functions here, let's say, as an example, beliefs. That's probably something that can be related. So some of the cultures, some of the places, and some of the patients might have different beliefs about their illness and about how they're sick. And their perception might be different from the like the Western healthcare provider perspective. So let's say illness as a kind of like let's say in the spiritual imbalance. Maybe the patient is more spiritual person than a doctor. maybe is more traditional person, so will not accept some of the recommendations from the doctor. Some of the patients might just say, well, I do not know if I want to make that decision now. Maybe that person is more family orientated, family, like the decision making is more like working out for the family as a team. They need to decide all together about something. Maybe the person doesn't want to do it by themselves. So that's something that the healthcare provider need to be aware. And like their perspective kind of need to change right away if they still want to have the same dialogue where they can when they can help people, right? So you will, in that case, can explain some of them, like some of the situations, some of their behaviors. If they are talking more in the spiritual way, if they're talking more in the traditional way, if there is something involved more than just their decision making, right? So in that case, the healthcare provider can understand everything, and there is nothing that can be misunderstood in that case, right? Another thing that you can avoid those misunderstandings between, let's say, if the patient is nodding their head, like maybe shaking in the other way that usually we are used to it. If they shaking yes, but it means no, well, you're gonna understand that, right? Because you are from the same place, you are from the same country, you understand that, okay, so that means he doesn't understand something. Even if he's nodding yes, and it means here, yes, it doesn't exactly have to mean the same thing for the patient, right? So that's something that you can right away catch up and interpret, and as well explain that if the doctor will ask, for example, well, he's nodding yes, what do you mean he says no? And that's something that you can explain as well to the doctor to avoid that misunderstandings between them. Sometimes, which is very common, and it's not only in the medical settings, but it's actually everywhere. The most simple one that probably everyone noticed is the eye contact. Now, for the eye contact, well, some countries, some cultures approach different way, but that also related to internal country kind of like idea and the cultural approach and the power level that in the country they're corresponding. So let's say some people avoid eye contact right away. Now, let's say if the doctor is from a different country and now the patient is from a different country, the patient is avoiding that eye contact, just staring on the floor all the time, do not look at the doctor at all. The doctor might to say like, well, that's a little bit disrespectful, right? From the other hand, maybe the doctor trying to stare at them, they're looking at the patient all the time. Now the patient kind of might feel intimidated or feel not respected. So that can work as well, like that. And that happens pretty much everywhere in every different settings. Their face expression, for example, that's something that can happen. I'm pretty much a good example. There's probably few of us here as a Slavic people. And I heard in Canada a lot of situations where people were saying, we're having party, it's like 3 hours in the party, everyone are laughing and they're happy. And they're looking at me and I absolutely look like I'm on some kind of maybe a serious situation or a funeral. And people are asking why I'm so mad at everyone, why I look so mad all the time. Well, that's just my face expression. I'm absolutely enjoying the place, right? But yes, that is my face expression. And I noticed that a lot on the streets as well, on the other places where people looking different at me. because I'm not always like running and smiling, maybe like the let's say a Canadians, for example. So it's a little bit different. Same with the eye contact. Well, I was learned to I learned that you have to look into the eyes if you're talking to someone, right? That's something that helps in the communication, but not everyone accept that. So again, some people also called me like, why are you looking at me like that? It kind of scary, right? But for me, it's pretty normal. So yeah, that's a good example. I guess I'm gonna be a good example for the rest of today's lesson. We'll see. All right, so how you can support patient doing this interpretation when you're the mediator now, avoid the misunderstanding. So pretty much healthcare itself, like if the person is going to the hospital or the clinics, maybe they never needed to go over there. If they were living in their country, nothing happened to them. They never went to the hospital. And now suddenly they broke their leg or something happened. Maybe there was, something serious, and now they're ending up in the hospital. So for them, just being there can be already stressful situation and can be intimidating. We were talking about the same thing. There was a video, I believe, about the court hearings when people are standing in front of the court building or entering the court rooms. Well, that's where the stress is starting, the fear, that you can feel it's serious and you feel a little bit intimidated by that. Same thing can happen here. So if you are that person with them, be sure that if they have to know that you can provide them the three basic things. So that they will be heard in this session. You are there to help them, and they will be heard. Whatever they will say, everything will be heard by you. They will be respected, and you are the person who will, in that cultural way, kind of protecting them from like anything that can scare them off, right? And it's a safe place for them, and they should ask questions if they do not understand something. They should provide feedback if they want. That communication channel should be open. If they have complaint, they should say about that. If they're trying to hide anything, the pain or anything, because a lot of people also will hide a lot of situations, a lot of pain, a lot of problems, because the doctor might say, okay, you now have to stay at home for 3 weeks. And that means the person, well, we're not going to work for 3 weeks. And that is scaring them a lot, for example, right? So you need to be sure that the patient is feeling safe, heard, and respected in the hospital or the clinics, right? So that's something that should be there all the time. All right. So cultural sensitivity. Well, actually, hold on. I have a movie. Oh, I forget I have my videos for you guys. So we can start watching from the first one. It's not exactly for the interpreters, but the idea is the same. So we can just hop into that.
Cultural competence.
Share the screen.
How many?
Peter.
Just one.
I don't know how many pages.
Yes.
Concept.
Okay. Where is my video? There you go. All right.
That's an interesting, I guess, idea more so in nursing.
I've never heard of cultural competency or competence.
Boy, you're asking a loaded question.
Everybody in the health profession should be culturally competent. I went to a 4-year bachelor school, and there was a lessons on cultural competency, and what that really was just teaching people that there are differences, to be aware of those differences.
So first and foremost, cultural competency means being open-minded to those differences, and then hopefully having some background and understanding that those differences exist, and per the culture that you're dealing with, having that knowledge.
Rather than just all in your mind, understanding that there are differences and something needs to be done about it, but what is there to do about it? They didn't really talk a whole lot about that.
What I was taught in school is supposed to be reflective of being able to understand different cultures and their different needs. But as I've gone through nursing, I think it's a lot more than just understanding the culture needs and being competent and understanding what cultures do certain things.
But if I were to just think about what those words meant, I would think that it has something to do with being culturally conscious and sensitive to the issues that the population of people you're dealing with bring.
The way I look at cultural competency, and it's a personal sort of approach, is to take all patients and treat them with the same respect that I would want to be treated, and afford them the same dignity. And that, I think, crosses all geographic boundaries, all race boundaries, all religious boundaries. And, it comes back to that, I guess, the golden rule.
The thing that you try to focus most on in cultural competency is providing the basic needs for each individual, and not just see them as a culture, but providing the healthcare as to that individual in the manner and the need that they feel is best suited for them to, for their complete and overall wellness.
Varias personas que realmente yo me he encontrado con varias que no saben nada de lo que es el inglés y sufren mucho en los hospitales.
Lo primero que hay fue con la pierna. Me duele muchísimo ya con el trabajo.
I'm sorry, sir. My Spanish is really bad. Do you speak any English? Okay. I don't really understand you. Can you say that again? Okay, down here? Okay. When did it start? Today?
Ya tiene un tiempecillo que yo me sentí muy mal. Entonces, cuando fui a la clínica, no me entendieron. Entonces, pues me dijeron que fuera a sacar nueva cita. Y no fui, dije, ¿qué caso tiene que saque nueva cita si me va a suceder lo mismo? No me van a entender y nada más voy a venir a perder mi tiempo. Y ya no regresé más.
Okay.
Me duele la pierna mucho.
My name's Kathy. I'm going to be your nurse.
Es muy importante los intérpretes porque uno lo necesita cuando uno no, porque uno puede decir me duele algo, pero a veces uno no tiene el concepto realmente adecuado al decir cuáles son los síntomas en realidad que tiene ese dolor. Entonces, realmente uno sí necesita un intérprete.
I'd like to also see if you have anything going on here as well, okay? Can you tell me how much it hurts? 10 being the most pain you've ever felt, and 1's just a little bit of pain. So little pain or big pain, a lot of pain.
I don't know if you're getting more frustrated or if he's in more pain.
Right.
Yo creo que posiblemente si ellos estuvieran un poco más cerca de nuestras culturas, sería para nosotros más fácil y para ellos también.
I've worked with interpreters, as mostly family members, a daughter or a son that speaks English as well as the person's primary language and translating through them. But still, there's room for discrepancy because perhaps they don't understand all the medical terminology.
First of all, I think having materials in their home language is very important. Then they understand that you, even though you may not speak the language, you are there to help them and address their concerns.
And I think that's the biggest thing as far as cultural competency. You have to be a big patient advocate, making sure that, there's an interpreter needed, that if you don't have everybody there on the same page so that message can be communicated all at one time to the individual, and not only the individual who you're caring for, but the person helping to make the decisions, it makes things go a lot smoother when everybody's on the same page.
But when you see a place like this, people are treated with dignity, their issues are addressed, they're listened to, and their problems and needs are attended to. I think that that's a great learning environment, and you teach the next generation through doing.
Yo estaba trabajando, me caí y luego de todo esto, cosas llenas.
I know you speak only Spanish, but we're going to have an interpreter come in. Interpreter. Okay? Escala du jour, finger, uno finger. Hola, me llamo Rachel, voy a ser la intérprete hoy.
Hola.
Hola, voy a interpretar todo lo que usted dice, tal como lo dice, y si usted no entiende algo, por favor de avisarme.
Hi, I'm Dr. Cole.
Hola, me llamo Dr. Cole.
So, could you tell me a little bit about what's been going on
Entonces, ¿puede contarme más de qué le pasó?
to your heart?
Voy a escuchar a su corazón.
Pain when I press?
¿Tiene dolor cuando aprieto aquí?
No.
Y tiene una tarjeta con más recursos de la comunidad que le pueda ayudar cuando sale del hospital.
Muchas gracias, gracias por ayudarme.
De nada, un
Ahora
placer.
sí lo entendí todo. Muchas gracias por ayudarme.
Gracias. Que le vaya muy bien.
Gracias.
I gave Mr. Fernandez a card with more community resources that he can use when he leaves the hospital.
Okay, that's good. I actually got the form for emergency medical assistance, but I'm not sure if you actually qualify for this.
Oh, well, even if he doesn't have documentation, he's eligible for emergency medical assistance.
Oh, okay, good. So I just need you to sign this, and then you can give it back to me, and I notify social work, and I also notify physical therapy for follow-up.
I'll take care of this.
Okay, thank you.
Thanks.
10 veces. 1, 2.
Oh, is there something that you guys noticed in this video that was pretty obvious? Anyone? No, nothing?
I think she helped him, helped the doctor to understand like they don't have even proper document stuff. So
Yeah, that too, but there was
Mhm.
something more. There was something. I'm not sure if you guys catch that part.
yeah, and
Yeah.
she added also the way the doctor can understand it, because he didn't say everything, but she also helped between.
So the thing that I'm actually saying here, that I'm asking for, that was most important to notice. Did you guys see how that man reacted whenever those two nurses were asking him questions, and he was so frustrated? And
Because he
kinda
didn't
like
understand nothing.
so he gave up already. And how he was smiling when the interpreter came and he heard the language, and the person that was there, like, you can kind of feel that relief.
Halfway already healed.
I would say yes, kind of, right?
Yeah,
So,
they already happy.
so that's where you, as an interpreter, when you're gonna show up to those sessions now, and you're gonna see those smiley faces finally, like, you can actually be sure that they are already treating you like a hero.
Right. That's right.
And that's why it's very important to show to those sessions when you guys accepting them.
Mhm.
It's one of the most important part. Because
Before,
now we have a lot of situations where the interpreter says, yes, I will be there. And then an hour before the session, interpreters say, well, you know what? I just don't feel like I should go anywhere today. So that means that poor guy who was just in that video gonna struggle there. And eventually they're gonna kick him out from the clinic because no one's gonna be able to talk to him. Right. So, and if we will go in a drastic situation and drastic outcomes, well, who knows? Maybe in 2 weeks later, when they try to reschedule him, he's gonna lose his leg because of
yeah.
that.
And also it's a difficult for the doctors and nurses too, because they don't understand what is the pain, what is they can help or not.
Well, that's another thing that was shown in the video when the nurses were, they were still trying to push their English. Like, yeah, so what is your level from small to like, come on. No, if something like this is happening, that's where the education is coming to here, and they should know that they should find someone right away. They should find someone right away and not just keep trying because nothing will happen. And eventually that patient just gonna lock itself away, and after an hour or 40 minutes, eventually he's gonna be sick and tired of sitting there. Even if the interpreter gonna show up, he will just
That's right.
he's not gonna
Absolutely.
want to cooperate.
Absolutely.
So that's something that yeah, we can keep in mind. All right, well, let's hop into that sensitivity in practice and what's going on here. So, like we're mentioning, I was mentioning in the about the beliefs and the values and what's going on. So, yes, that's something that need to be recognized by the healthcare providers, and it need to be respected as well. All right, we're all coming from different places with the different backgrounds. And I believe the healthcare providers also want to be respected. So that should be something that works both ways. So in this case, that sensitivity should be implemented in the healthcare services. Doctors and nurses, they should adapt a little bit more to different diverse beliefs, to those different values, traditions. The patient have this background and is from and is following. So there should not be judgment from them, never. They should accept the patient as it is, as a human who need help, and they should respect what the human believes for, and they should be aware of that. So I would say yes, they need to follow kind of like a strict code. So like you guys heard in the video, some of them had some classes about this, and that should be provided in all different settings for sure. So respect the beliefs, their values, their traditions, and like whatever the culture of the patient is, their religion, their life experience, like those things should be respected by the healthcare providers. And in that case, also you are there to help those healthcare providers understand if they cannot figure out different things, right? Let's say there's a person that do not believe in medication, a modern medication, and let's say the patient will say, well, I'm always healing my wounds traditionally, and the doctors are totally unfamiliar with that, but well, they should still listen to the person. They should still, if it's not life-threatening or not serious, they should kind of like respect those traditions that the patients have. Some of the patients, we were talking about this regarding the family involvement. So the family members, yes, they can be involved in the decisions, especially for the minors. They need to be aware of that. Now, let's say if we can compare maybe some of the countries where you're adult more like when you're 18. And I believe in the US, you have to be 21. Those are two different things. Now, in that case, family still have a little bit more impact on the decision making in those two different environments, on the two different level of age, right? So there is also different countries might have different rules. So the healthcare providers need to follow that. Stereotypes. That's something that if any healthcare provider going to start doing that and start the assumption going to come out and stereotyping people, it might to end very bad. So we need to be aware that not every single person with the same background is the same as they had a contact with, thinks the same way, or have the same beliefs, or will act in the same way, right? Again, we can have, I can be a good example here. We have Polish people who, well, one of our natural thing to do is, well, drinking vodka, right? And for us, I mean, there was always, my grandmother was always saying, if you're sick, you just need to have a good shot of cold vodka with the pepper. And it helps. Now, if you will look at the doctor gonna just look at me and start asking if I'm actually normal to start doing that, because eventually how many shots and how many pepper I have to eat to feel better. But yeah, sometimes those are the things. Now, also Polish people like me, well, some of them can be rude, some of them can act bad. We are very straightforward people. We do not sugarcoating. So some of our comments, especially for the Western culture here in Canada, might offend people. We don't want it. It's not on purpose, but sometimes the patient might be too direct to the doctor, and might to have, well, not gonna play around, for example, and we'll start maybe, calling the names. And now the doctor gonna assume like, oh my goodness, I had that Polish guy with me, and now another one is coming, and then I have to do again the same thing. So his assumption and stereotyping is already there. But that second person was totally different. So, well, I mean, this is something that we can mention to people, but I believe you can teach them how to not stereotype or put any assumptions. If you will notice anything like this during your sessions, it's always good to politely tell the doctor that it's not the same person as you had experience with. This person is different. It's a totally different human. And there should not be any stereotyping regardless. So, also, the doctors might assume that, oh, I had a patient with the same issue, and he will assume that, well, it might be the same medication needed, or we're going to do the same procedure or something. No, it's always good to ask first before assuming anything, because that person, even if they have the same thing, might be with a different background and will react to that different, right? Listening instead of like putting those labels of people. So yeah, it's again something that should, in a medical practice, should never happen. In any practice, same thing with the legal. That's where it's also included in the code of ethics for interpreters. where you cannot make any assumptions, when you have to be neutral, when you cannot also stereotype people, right? So yes, treating each patient, whatever it's for medical purpose or legal purpose, they should be respectful, and also you should be respectful. So each patient is always an individual. It's not a group of people, and they're not the same. So if you have a basket full of apples, well, not all those apples might be the same, right? So if there is one rotten apple, it doesn't mean all of them have to be. So just keep that in mind, and it will help. It will help for sure. Gender roles. That's something that also can be missed by the medical healthcare providers, right? Some of the patients, there is a lot of situations when we receive the requests from the hospitals and they just say that we want interpreter. When we send the interpreter, who might be a male, we're sending that interpreter and the patient is a female, well, it's not gonna work very well for certain appointments. But again, this is something where the healthcare providers miss that education. They do not think about this. So they're not value that person enough to figure out that maybe, well, there should be a different approach. Maybe we should mention that we need, let's say, a female interpreter for that, right? Now, some of the religious beliefs that let's say the Western healthcare providers will not follow the same in the way, may affect the diet of the patient, right? Use of some of the medications, maybe some of the people cannot use some medication for any purpose. Procedures might be different. So, and eventually, if we take on like an example, the person from the video, eventually that person could lose the leg, or maybe, you know, there was something happening inside the leg. Eventually, maybe their veins were not working the proper way. The blood flow was stopped, and well, that was leading to a heart attack. And yeah, the end of life of the person. Now, also the end of life decisions are made different, especially if we're talking maybe between individuals and the family. Whenever the decision making is you know, for everyone. So those things, everyone should be aware whenever the patient is coming to the place. That's the part when they have to feel safe and respected, and they have to know that they are heard. So the best practical and like the communication approach, always neutral tone. As an interpreter, your tone is usually neutral, unless it will swap from the interpretation of the patient, where you need to show those emotions, you need to show their anger or their happiness as well. So it's not always about the bad things, right? So but starting the conversation, introducing yourself, telling the patient, why are you over there? Yes, use the neutral tone as well. And always recommend the healthcare providers that they should use neutral tone as well. So no judgment in the voice. Like you can feel sometimes in the voice that may be a little bit of sarcastic voice, where the opinions are made already in their heads. And you can feel that, you can hear that in their voices as well, right? So that's something that's in the communication between them will not work very well. Maybe the patient will catch on that very quickly, and the trust will just fail pretty much. Well, again, for the interpreters, is like for you, everything needs to be said directly. Everything needs to be said as it is. No, nothing more, nothing less, nothing skipped. always you have to be professional with them. So still you want to be friendly, but professional friendly. So you need to have those boundaries. We're gonna talk about this later on as well. Where yes, you are kind of like there to help them out, to feel them comfortable, but again, you don't want to show them that now you are their best friend and they can do whatever they want because you are over there, right? So that's something that will help. Again, for example, let's say if there's a procedure and the patient refused their procedure, so you need to tell that exactly to the doctor if something like this is happening. Maybe there is you can hear maybe the fear, or they do not believe in that, or you know they're kind of like their values are influencing any decision they're making, and maybe they cannot do that procedure. So in that you have to deliver the same meaning and that same concept to the doctor, so they can understand. And in that case, again, patient will feel understood that and heard. The communication is between them as well, and eventually that trust will grow because now the doctor, let's say, maybe say, okay, let's find a different solution. So let's leave this procedure idea for now, but we can maybe find a different approach to help you out. And in this case, it will be totally different outcome from that place, right? From the conversation. So if we have to summarize this sensitivity, I would say be always aware, look what's going on, look for those little different tone in the voices. If you understand already some of the differences, you can help communicate and tell the doctors, well, be always respectful for both parties. So, and well, I would say if you can adjust yourself, because well, maybe you are totally not related as you as a person. Maybe you have totally different beliefs than people in the room. So again, try to adjust. Do not judge. Do not stereotype or question their values or beliefs, right? So that's something that we have to keep in mind. All right. Common challenges. So we have that is happening a lot. And we've seen that in the videos as well. So there can be different understanding of a pain. And the pain expression, for example. Now, I'm here again as a good example for this. In the 2010, I had a bad car accident. And eventually I ended up for 9 months in the hospital, where my hip and my knee and my shoulder, my full right side was totally broke. And it was very difficult to move. And I was laying in the hospital. Eventually, well, what the doctor figured out after the first hour that they brought me, like they picked me up from the street. Well, I fell out from the car basically. And after I woke up in the hospital, everything I saw in there was 2 doctors, 2 nurses, a big drill with them. And well, eventually they wanted to do some injections. So it came out that they have to drill through my bone in my leg to wire it up and hang it so my bones can actually like get together after some time. So I was hanging like that for 3 months. Not the fun part. Well, what I'm going to is that my reaction to the pain and my expression when they start drilling in my leg and I start feeling they getting through my bone, I start to laugh. I was laughing like a little baby when you try to tickle it. Like seriously, that's how I was reacting to the pain when I started feeling the drill going into my body and my bones. So I was laughing like a little baby. And people were looking at me like if I'm okay. Well, that's my reaction to the pain. Not all of the pain, of course, but somehow anything that's related to my bones, and I feel like anything is happening in my bones, I react laughing like a little bit. So that is my pain expression. That's how I can show my pain. And well, people obviously not going to understand that right away because, yeah, the first assumption from the doctors might be, okay, this guy's a weirdo or he just loved the pain. But no, I still feel the pain. It still hurts. There is still the pain. And I felt and I hear that drill going. It was painful, but I was laughing like a little baby. So that's how it is. Another one might be, well, the mental health, where people will start acting different, answering in a different way to the questions. So that can be the challenge where a simple question can turn out to 2-hour sessions because now whatever is happening in the head of the patient doesn't exactly answer what the doctor is asking. So they can talk about totally different things. And your role is over there to still provide the interpretation word to word as accurate as possible. And we talked about this a couple sessions before. I believe Azeb was mentioned that where you have to keep repeating the same answer over and over and over again, and it has nothing to do with the question. Well, unfortunately, you cannot do anything about that. So again, that can be one of those cultural challenges where you cannot just make those assumptions. You cannot just tell them what you think. You still need to stay neutral. You still need to respect that person and, maybe find a different approach. Who knows? Maybe if you provide a piece of paper and the person will start to draw something on the paper, that's where the doctor can understand what's going on with them. So that's another example for this. Now, again, you have, let's say, a family members, again, right? So individual decision-making and more like a family, like collective decision-making for the person. So in that, like some, in some cultures, it's actually a mandatory where there must be a family involvement in all medical decisions, for example. And in that case, that person still need to be understand. There can be a potential conflict, right? Because you are now interpreting, but like 3 weeks ago, Peter told you that you should not interpret for the family members. And now you're in this internal conflict here in your head, like what you should do. Again, even if there is that a family involvement, for Canada healthcare, it's mostly related and prioritize individual consent and their privacy, right? So you need to here be, again, this mediator, not only the interpreter, and you need to explain both parties how does it exactly works and what they should be prepared for, because the doctor might not understand. And let's say there's a room, the doctor is waiting for a patient while you arrive there first. So you were sitting with the doctor and suddenly there's 50 people hopping into the room. and the doctor has no clue what's going on. And that's where you can tell them, like, well, that's what's going on, and that's what will happening, and you have to respect their decision as well. I will tell them what's going on from the end of, healthcare perspective, and maybe you guys can find here you can cooperate together. Okay? So that's that's something that can maybe work out. Traditional medicine, well, that's probably coming a lot in all countries, all cultures. We all have the things that, our grandmothers show us what to do if something will happen. Maybe some herbs, maybe some spiritual healings, maybe vodka and pepper, like in my case, and my grandmother teach me. Who knows? But yeah, if you're going to Canadian hospital, well, they're gonna say, like, no, you can't just use some grass leaves or anything, because you need a medication. You need to have this and that to not lose your life. So there is a lot of those situations when it need to be explained, because if the doctor will not respect that, and they will not, maybe there are some of the herbs that the person is using, let's say, for their traditional medicine, that are also, that their medication here in Canada have the same structure, using the same things together. So there will be, like, any drug interaction will not be misunderstood, for example, or will be follow up with the steps. Again, maybe the person actually feel better about the different things, so the medication is not needed. So that traditional medicine need to be also explained to the doctor, and what they're using. Maybe they're using this, but it's dangerous to them, right? That can happen as well. So yeah, that's something that you have to be aware as an interpreter whenever that come to you can also, like, if the doctor is asking the person, okay, so, well, if you are from this place, are you using this flower, for example, to try to heal yourself, right? And then they will say, well, yes, I'm using this for 2 weeks, and the doctor will say, well, that's why you feel bad. You have to stop using this. We have to find you a different solution. So yeah, there is a lot of different aspects here. For the interpreters, so you're like, you as this kind of like interpreter, so again, you are avoiding that misunderstanding from both parties. You are over there to help them kind of educate itself. Again, you have to be accurate in both translations. So from English to the mother tongue, and from mother tongue to English. Everything needs to be understood exactly as it is. Accuracy, again, well, that's number one. So just keep in mind that now you are not just the person who randomly providing the words, but you are the person who provide that relief to the patient as well. So that's kind of changed everything, I hope. All right, another video here. Let me just play it quickly. That was number two. These videos are a little bit longer today. If they're boring, you guys just let me know.
A Spanish-speaking Latina woman brings her daughter Rosa to see her pediatrician for her annual physical. Because the clinic receives federal funds, it provides competent language access services at no cost to its limited English proficient patients. A trained interpreter is present during the visit to serve as a conduit between Elena, her daughter, and the clinic staff. The Sanchez family is not alone in its struggles with weight. To help address their patients' needs, the clinic has started a wellness program for families. The program focuses on prevention messages that are culturally and linguistically appropriate. Topics addressed during this video include importance of culturally and linguistically relevant prevention messages, the role of the interpreter in a clinic and consultation visit, the importance of community resources and family support in program adoption and adherence.
Good afternoon. How are you doing?
Buenas tardes, ¿cómo está?
Bien, gracias.
Good, thank you.
Today we are here for Rosa's annual physical for school. Is that correct?
Hoy en día estamos aquí para el examen físico anual de Rosa para la escuela, ¿es correcto?
Sí.
Yes.
And right now, I'm concerned that Rosa's age and body mass index are telling us that she's at greater risk of being an overweight adult.
Ahora estoy preocupada que la edad y el índice de masa corporal de Rosa nos indiquen que ella tiene más posibilidades de ser un adulto con sobrepeso.
We'll continue to monitor her progress.
Pero vamos a seguir vigilando tu progreso.
Bien, gracias.
Good, thank you.
It's good that you feed her well and that she's staying active, but I'm still concerned about her weight.
Es bueno que lo alimente bien y que se esté activo, pero sigo preocupado por su peso.
She is overweight for her age, which is putting her at risk for diabetes and heart disease.
Ella pesa de más para su edad, lo cual lo pone en riesgo de tener diabetes y problemas de corazón.
Also, this extra weight throughout her childhood and life would mean a greater risk for other chronic conditions.
Además, este peso extra a lo largo de su infancia y su vida lo pone en mayor riesgo de tener otras afecciones crónicas.
But it's important to know that if she starts making healthy choices now, the risk for these will decrease once again.
Pero es importante saber que si empieza a escoger opciones saludables ahora, el riesgo de tener esto volverá a disminuir.
Getting Rosa to a healthy weight now is very important in preventing health problems later in life.
Lograr que Rosa tenga un peso saludable ahora es muy importante en prevenir problemas de salud más adelante de la vida.
There's an education program at this clinic that you might be interested in, and Mary can give you more information about it.
Tenemos un programa de educación aquí en la clínica que le puede interesar. Mary te dará más información sobre esto.
We'll see you both soon.
Los veré muy pronto.
Rosa, have fun playing.
Rosa, diviértete jugando.
It's good to see you again.
Muy bueno verla de nuevo.
Dr. Gilbert wanted me to further explain the wellness program we offer right here at the clinic.
El doctor Gilbert quiere que le explique con más detalle el programa de nutrición que ofrecemos aquí en la clínica.
The clinic has developed a nutrition and physical fitness program for kids like Rosa and their parents.
La clínica ha desarrollado un programa de nutrición para chicos como Rosa y sus padres.
The class runs for 6 weeks, 2 days per week.
La clase tenga una duración de 6 semanas, 2 días a la semana.
The really great news is that Rosa will know many of the kids in her class because they attend the same school that she does.
La buena noticia realmente es que Rosa ya va a conocer a la mayoría de los chicos en la clase porque ya asisten a la misma escuela.
And you'll also get to meet other parents who also want to help to make their families healthier.
Y usted encontrará con otros padres que también quieren ayudar a sus familias a ser más sanos.
Do you have any questions?
¿Tienes una pregunta?
No, Rosa nunca ha participado en ese tipo de clase y yo nunca he escuchado a nadie hablar de ese tipo de clase. Entonces es difícil para mí hacer preguntas en este momento.
No, Rosa has never been in such a class and I've never heard of such a class before, so that's why it's hard for me to ask questions.
Y tampoco estoy segura de lo que están sugiriendo. Trabajo con muy pocos recursos y doy lo que pueda a Rosa.
And I also don't know what you're suggesting. I work with very little resources and I give what I can to Rosa.
I recognize your concerns, but I believe that we can work together to keep Rosa healthy.
Reconozco tus preocupaciones, pero creo que podemos trabajar juntos a mantener saludable a Rosa.
She'll learn more about how to stay healthy as she gets older. ella aprenderá más acerca de cómo mantenerse saludable a medida que crece.
Pero ella ya es una chica saludable. Yo le preparo tortillas y frijoles y otros alimentos de mi cultura. Y ella juega fuera de la escuela con otros niños.
But she already is a healthy child. She eats beans and tortillas and other foods from my culture. And she always plays outside with other kids after school.
That's great. We do not want to change the foods that you're eating entirely, but we do want to help you to make these meals a little healthier.
Es genial. No queremos cambiar por completo los alimentos que están comiendo, pero sí queremos ayudarle a preparar estas comidas en forma más sana.
We will also work with both of you to help her to understand and choose healthier eating options.
Trabajaremos con los dos para ayudarle a elegir y entender y elegir opciones más sanas.
In the classes, Rosa will have the opportunity to learn about healthy eating and exercise.
En la clase, Rosa aprenderá sobre la nutrición y el ejercicio.
She will also play interactive games that teach her about what foods are better for her body than others.
Jugará juegos interactivos y le enseñará qué alimentos son mejores que otros.
We will also teach her about fun ways to stay active throughout the day, even at home.
Y también aprenderá maneras divertidas de mantenerse activos durante el día, incluso en casa.
Ok, bueno, yo creo que suena como un buen plan, pero me preocupa que ella va a pensar que algo anda mal con ella. En mi cultura, ser capaz de sentarse derecho, tener piel y pelo saludables, son más importantes del peso adicional de un bebé.
Okay, I think it sounds like a good plan. I'm worried that she's going to think something is wrong with her. In my culture, to be able to sit up straight and have healthy skin and hair is more important than a little extra baby weight.
I understand you have doubts about this program.
Reconozco que tiene dudas sobre este programa.
We have Rosa and your best interests at heart.
Pero tenemos a Rosa y sus mejores intereses en el corazón.
You've been coming to this clinic since Rosa was 11 months old. We would not suggest this program unless we thought it was appropriate.
Usted ha estado viniendo a esta clínica desde que Rosa tenía 11 meses de edad.
Sí, ya veo. Al principio tenía miedo cuando me estaban explicando el programa, tenía miedo que estaban tratando de cambiar nuestro estilo de vida. Pero ahora ya veo que el programa ayudará a Rosa y yo a aprender sobre la vida sana.
No, I see. At first, when I heard about the program, I thought you were trying to change my lifestyle. But now I realize that this will help me and Rosa learn more about healthy living.
I'm glad that you took the time to listen. We at the clinic are here to help.
Estoy contenta que haya tomado el tiempo de escucharme. Nosotros de la clínica estamos aquí para ayudar.
Would you like to get started and sign up for the wellness program?
¿Quieres empezar ya y registrarse por el programa de bienestar?
Sí, me gustaría darle una oportunidad.
Yeah, I'll give it a try.
Great. I'll get the registration form.
Bueno, voy a buscar la forma de inscripción.
Please consider these self-guided questions. What was important for Elena to learn about the program? What role did culture play in prevention messages? Did you notice the use of the triadic interview regarding the positioning of the interpreter, patient, and the clinic staff member? Did you notice that the clinic staff made eye contact with the patient's mother rather than the interpreter?
So,
Everyone, my name is Nanji Mateo. I'm the founder of interpremet.com, and this video.
Stop. Thank you. So, what do you guys think about that? Does the mother was concerned? Was she right about being concerned? Oh, okay. Fine. Let's talk about something else then. Nope, not this one here. Where's the presentation here? There it's. All right, so quick summary. Yes, the mother was concerned because it was against the culture thing that they were used to and they grew up in, right?
But in the end, she agrees, right?
Well, yes, because both the healthcare provider and interpreter were able to
Fix it.
change the tone. Like they were able to provide that information, kind of like because they care, right?
That's right.
She also mentioned like you are coming here since baby was 11 months old, and so they assure her that they are not here to hurt her. And you could notice how the interpreter was also delivering those messages, like in that friendly way, in the friendly tone, smiling. She was like mimicking pretty much the same tone idea as the nurse had over there to help that out, right? So eventually, it turned out a mother way of thinking that yes, you are not destroying the cultural idea of the baby. She will still be the same.
And in the beginning, she was misunderstood, but in the end, she agreed, right?
So there was that was the whole idea, right? So eventually, yes, from that's not really to trust, she turned out to be person. Okay, I can go with it, right? And yes, there was a big role playing the interpreter over there, a huge role to not only provide the interpretation but also like give her that sense of the safe space, kind of, right? So that was.
And options were given too.
Yep. So that's something that yeah, you can keep eye on. All right. Engagement. So as you notice, like yeah, so there is some issues regarding the engagement of the patients, and sometimes they're not. So and that's something for the like if we follow also the video here, the previous two. The first video, the patient was not really able to engage and not willing to engage. In the second video, well, the mother was very not trusting on the beginning, the person, right? So that interaction was kind of like I would say maybe not hostile, but something that they're not feel safe still about. So whenever there is a healthcare provider, the patient, and there's the interpreter, that's where the conversation will change. And especially like if you're speaking in the first person, it also help to understand that you are talking directly to them as an extension both of the doctor, healthcare provider, and for the doctor as a patient, right? So it will change the tone a little bit more and their perspective of seeing each other in that room. So again, that eye contact sometimes is necessary to whenever they looking at them, and also you are looking at them when you delivering the messaging, and you notice that the nurse was pretty much just keep looking at the mother, just to assure her like yes, you are safe. So that's something that healthcare providers and interpreters need to understand, that flow need to stay. It need to be still, like they need to feel safe and heard. So that direct communication need to stay over there. Understanding, clarity. Well, in this case, you need to be sure. That's pretty strictly a technical rule. You have to be sure that the message and the words that you deliver do have the same meaning. Now, a lot of situations might happen whenever you are in the medical or legal settings. Eventually, you can, if you don't understand something or you struggle to understand something, well, ask them, can you please repeat? Can you clarify? Can you help me to understand first before I deliver the message, right? So that will help kind of like, it will help to prevent your errors, any miscommunications between the patient and the healthcare provider, any assumptions. So don't be scared asking those questions as an interpreter. If the healthcare provider will start asking questions why you're asking those questions, you should know that you're the interpreter. Well, no, you're not, right? There might be some words that do not even exist in your vocabulary. There might be words that you never heard of, even if you are okay for providing interpretation in general in medical settings. But maybe there is some condition that no one heard of, right? Like we are not exposed to all medical terminology on a daily basis. And I'm pretty sure that like we cannot memorize all of them. So if there is something that you are not sure, you can always ask them. Just don't be scared of asking those questions. Also, if it works the other direction, where the patient is providing the information, and well, let's say maybe they're from a different part of the country that you are from, and they are using some kind of a slang that you do not understand, ask them to explain or just clarify something, because now you have to deliver the same message to the healthcare provider, and that will pretty much support like the decision the doctor gonna make, right? So in that case, yeah, it worked both ways. And again, I'm a pretty good example here too. Like in Poland, we have people back in south part of Poland, and I'm from north part. And well, if they're gonna start talking in their jargon and their slang, there is no way I can understand what they're talking. So same thing in our part and north part. Yeah, again, we have specific kind of dialect that we can use. Well, it's almost dead already, but elders still understand it. But yeah, people from the south or other part of the country will not understand what I'm talking. So there is those situations where you might have that situation and can ask clarification from the patient. Now, the building that trust, well, we're talking about this all day, pretty much like this whole webinar today. So yes, you need to be sure that the patient feel that there is a trust, they can trust you. It's important, especially if it's like a stressful situation. It's an emotional situation. If you are being involved in those interpretations whenever you have to deliver that message, so they need to feel that they're in a good spot. It's trusted, right? Respectful, professional tone. Again, stay neutral, stay respect, but still be professional. Again, thing that I always say take under consideration is delivery of the words. So be confident in the words you're saying. They cannot see that either parties, they cannot see now that you are like you just doubt in your own words what you're translating, because they're gonna start questioning. Are you sure what you were saying? If are you sure that's the thing that the patient wanted to say, right? So be confident. Well, the patient dignity, again, there are a lot of different sensitive topics. Well, maybe not all of you will be assigned to them right away, but we never know. But yes, we're talking here about any kind of trauma, maybe. Some personal history, maybe whenever the patient feel more vulnerable during the appointment. So maybe there is a situation where, again, we're talking about the mental health issues. When the patient will gonna feel like, okay, that's very awkward situations. So yeah, that they have to feel that you and the healthcare provider will listen. They would need to feel like they're heard, they're respected, and they're in a safe spot. So yeah, that's something that we need to be aware of. It's not coming always like, right away. It's something that, well, you guys gonna need to practice for sure. Because I'm not saying that you will now go tomorrow to the hospital and you can provide this this good, safe environment, because there's a lot of different factors where you're not going to be able to. Maybe you will not going to feel it right away to do it. Maybe you're going to feel like it's weird to now for the stranger you have to provide the safe, big, safe place that the patient need to be heard. Or maybe just the the healthcare providers will not allow to that. Maybe it's going to be a very rush session. Like, oh, I only have 5 minutes. I have to go to other patients. So here's the here, just take those 2 pills and come back in the next month. So again, there's a lot of different situations, right? All right, boundaries. So again, professional, your responsibility as an interpreter. So number one, everything is confident. You have now access to a lot of confident information of the patient. So they have to stay with you. You cannot share those information anywhere. And it not only, like, it pretty much applies to the whole process. So before the session, you're receiving those information from us already in your confirmation. You have the names, you have the claim numbers, you have the case numbers. Sometimes you have topics of the appointments, what's going to happen. So we prepare you for that. And you have to keep that confidentiality at that point already. So during the session, again, you need to state to the patient that everything is confidential. You provide that. It's a part of the code of ethics of the interpreters. Confidentiality is the same important thing as accuracy. Eventually, after the session, yes, you can just leave the hospital and now post it on the Facebook like, oh, guys, you never guess where I have been today, right? So no, we don't want to do that. Another thing that is your responsibility, well, staying impartial, be a neutral person. So again, you want to be friendly, but you don't want to overstep with that. You can deliver the message in a friendly manner. You can follow the tone. You can mimic both patient and the client. But you cannot tell them, oh, well, let's go for a coffee now. You don't want to overstep that. So that's something that you still need to stay neutral. Again, before, during, and after the session. That's something that just have to be, because if you will not, eventually it will affect both of you. And well, at some point it will end up not very well, both for you and for the patient. For the patient, because eventually you're going to start rejecting all that whenever they ask for help, and now they're going to feel left alone. Make maybe complaints, and eventually it's going to end up not very well for you, because now you're breaching the contract, you're breaching the code of ethics. And well, if Peter gonna hear that, we're gonna have a chat probably, and not, yeah, there will be some consequences for this. Another thing that can happen eventually, if you will get too close to the patient, the healthcare provider is going to start noticing that. Now they might to question your interpretation. They might start asking questions. There might be some complaints like, hey, maybe that interpretation is biased. No, right? The worst case scenario, well, they said I need to replace interpreter because I do not trust this interpreter anymore. So please do not assign this interpreter to this patient anymore, right? So, and eventually you might lose a program for WCB. You might lose future appointments, maybe for the same patient, maybe in the same clinic. So we had those situations before, and well, it happened. It's happening all the time. And eventually, you know, maybe you're not gonna go to that hospital or the clinic for the next 2-3 months because they said like, well, you're not trustworthy, right? So keep in mind, being neutral is very important, very, very important. Now, there's always that communication that you as the interpreter need to support. So you do not want to be the boss of the situation of the meeting. You want to be more like a support. So it's not like you making the orders and control the situation. It's more you support the communication between them. So in that case, you still providing this understanding to the both parties, right? Their interactions like still need to stay on the same level, and you were there to help them communicate, even if there is that gap in the cultural gap or any other. You still want to support that communication between them, and you just don't want to make it a hostile environment. So that's something that need to be held. Now, all the difficult situations, well, there's many of them, and probably some of you already experienced them. Some of you will experience them in the future. So again, if there is something difficult, if there's a difficult topic, like really someone is joining now, 20 minutes before the end. All right, so yeah, if it's something is unclear, ask for clarification. Everything needs to be delivered accurate. Cultural misunderstandings, you need to let the parties know, because that can create a very difficult situation at some point during that sessions, right? Any ethical concerns? Well, you will need to follow the protocol of simple translation mostly. We will talk about the actual protocols in the future, because they're like the general rules that are in the onboarding package. They are also the rules we send to you in the orientation files, and they are the protocol that we are talking about all the time, constantly. But eventually, if you will go to the hospitals and clinics and you will start managing those difficult appointments, that we're going to talk about them probably in 2 weeks, something like that. Yes, there are protocols that you need to follow, that you have to, but those protocols are not just because we telling you what to do. Those protocols are also to protect you and to feel you, there for you to feel safe as well. So though sometimes we have special protocols for medical appointments, for WCB appointments, even for legal sessions. But yeah, most of them are usually stated, but sometimes interpreters still calling us because, you know, life happens and there are different scenarios happening. And we need to find also a answer to that right away. So we will go through that. But yeah, summarizing for the boundaries: accuracy, neutrality, awareness. Be aware of the cultural gaps and your professional approach. So just keep those things in mind. Okay, we're pretty much done. So, questions, feedbacks, concerns? Who's first? We have 50 minutes, so we can go through something. I have a couple of I actually had a, let me see if I have oh, there is actually one more video. Let me maybe play it at the end about those cultural differences. This one is short. It's just 3 minutes, so let's just have it for the end, and then we can have a quick chat.
Hey.
Hey.
There, health warriors. Have you ever faced a situation where a language barrier, cultural belief, or religious practice impacted patient care? As our world becomes more diverse, cultural competence is no longer optional, it's essential. Today, we're breaking down why cultural awareness matters in healthcare, common barriers, and practical ways to improve patient-centered care. Let's dive in. Cultural competence means understanding, respecting, and responding to patients' cultural, linguistic, and religious backgrounds to provide personalized, effective care. It's about recognizing that healthcare is not one size fits all. When patients feel heard and understood, they're more likely to trust their provider and follow treatment plans. What are some common cultural barriers in patient care? First, patients who don't speak the dominant language may struggle to understand diagnoses, treatment options, or medication. So, what's the solution? Use trained medical interpreters instead of relying on family members. Second, some patients may refuse certain treatments due to religious beliefs. For example, Jehovah's Witnesses rejecting blood transfusions. The solution here? Respect religious values while offering alternative treatment options that align with their beliefs. Third, in some cultures, mental health issues are stigmatized, leading to reluctance in seeking care. The solution? Approach sensitive topics with respect and cultural understanding while educating patients on available care options. Fourth, some patients prefer same-gender providers for exams and treatment. When possible, accommodate their preferences to increase comfort and trust. Recognizing and addressing these barriers leads to better patient satisfaction and improved health outcomes. Now, what are some best practices for culturally competent care? First, ask open-ended questions. Instead of assuming, ask, are there any cultural or religious beliefs that might affect your care? Second, use professional medical interpreters. Avoid using family members as translators. It can lead to errors and loss of privacy. Third, be aware of nonverbal communication. Eye contact, gestures, and personal space vary by culture. Adapt accordingly. Fourth, provide culturally appropriate health education. Use visual aids, simple language, and culturally relevant examples to explain conditions and treatments. Fifth, advocate for inclusive policies in healthcare. Ensure diverse representation in healthcare teams and training on cultural sensitivity. Small efforts in cultural awareness make a big impact on patient trust and care quality. Cultural competence isn't just a best practice, it's a necessity in modern healthcare. By breaking down language barriers, respecting diverse beliefs, and personalizing care, we create healthier communities and stronger patient-provider relationships. Have you ever faced a cultural barrier in healthcare, either as a provider or patient? Share your experience in the comments below. Like this video? Give it a...
All right. So, well, that was directed mostly to the medical care, but I just wanted you guys to see there's the same context, right? So that education is ongoing, but well, not all of them are choosing to be educated. All right, we have some time, so we can have a chat. If you guys want to, if not, well, then we can end up a little bit earlier today. Wow, that's so loud. Not everyone at the same time. Come on, guys. Okay. Well, let's end it then today. So yeah, hopefully at the end of today's session, there was a little bit different. You could understand what's going on from a different perspective. And again, this is just another proof how important you are in those appointments. There's a lot of situations when you will be joining in those medical settings. Some of you already are doing some heavy stuff for AHS. And sometimes even the WCB, I believe, those appointments can drain you out a little bit as well. So at least now you know how to approach it a little bit better, and maybe it's gonna be easier for your sessions. So hopefully. All right. So tomorrow legal again. That's gonna be Wednesday. Thursday we're doing the number 5 for medical, and Friday we're gonna do summary. And then I have to find out how we're gonna split you all to the groups and start doing the examinations. I was thinking probably maybe the group of 20s. So 21st, 22nd, and I will provide some times and dates for next week, and whoever can do it, just let me know. And then I'm gonna assign you to that group, and then we can do it. Okay. I have to write everything together. Oh, now there is someone wake up when I want to say bye. Now you guys are waking up. All right, Mingwen, hello, how's it going?
Yes. Before we finish, I have a question about our exam. Well, what's the style of exam will be? Oral, or we need to write some paper?
Well, yes, you will write some answers probably, and then some choices. I just want you to kind of like understand what are we talking about here. So, but I also don't want it to have a boring multiple choices all the time.
Okay.
I also like to see your perspective to answering some questions, and that can also like the examination is not just to examine whatever you learn here or you didn't, but it also kind of is a feedback for me.
Okay.
Where we as a company and me as a coordinator, all the requesters are making the mistakes, right? Because even if I'm talking about all those things here, your answer will be totally different than mine, but it's still gonna make the same sense. You know what I mean? So I would like to have some scenarios, probably a few, where you can provide the actual answer to this.
Okay. Okay, I see. I see.
Not too heavy. Like I said, we're gonna split it, so 5 modules and 5 modules at the end. So yeah, I think we can do like maybe 50, 40 questions. We'll see.
Okay.
All right. We'll see. Yanina, you have something?
Yeah, thank you very much. I have a question regarding the sessions because unfortunately, I had some interpretations at the after lunch, so I missed a few. So before I jump into the exam, I wanted to know when can we expect the sessions to be uploaded?
So you're not reading my emails.
I read the one yesterday where it said we were not.
Did you read the one when I said we have a YouTube channel with all the playlists and are uploaded over there? All the
Probably I haven't received that one. I will double check. The last one I received was the module 3 upload email, and that's it.
So yes, I will send you before I go home today.
Okay, thank you very much.
So we are uploading everything to YouTube so everyone can watch it. Currently, we have 4 legal and 3 medical. So today is the 4. I will send this one tomorrow morning to our IT guys, and they're gonna upload it as well.
Okay, I remember you mentioned YouTube channel, but I haven't received the link. So thank you very much. Thank you. Have a great day.
Sure.
Same for me. Same for me. I also didn't get the email about the YouTube link.
Okay.
See, I'm not the only one.
All right. Well, you can go to YouTube, just type Sandal Translation Services, and you're gonna see the channel, and then you can help.
Okay. It's open access, right?
Oh yeah, yeah.
Okay.
Okay, sounds
What's
good
the
then.
name of the YouTube? It's called Sando Translation Service.
Yep.
Okay, perfect.
I think so. Well, let's see. Oh
Okay.
my God. You guys are always like telling me stuff, and then I need to double check everything.
Let me check. Oh, I got the YouTube. Yes, perfect.
Is it? Yeah. So
Perfect. Yeah.
Oh yeah,
Yeah,
yes.
that's
So
good.
go there, check it out, visit, make me famous.
Okay.
All right.
So good. Thank you.
Osge, you have something as well.
So what happens if we fail the exam? Do we have a chance to retake it?
No, I'm just gonna fire you.
Oh, okay.
Okay. Yes, we will do. So again, examination is not to say you're good or bad. The examination is for you to understand what's going on, and it's a summary. Let's say if we're gonna have 40 people, and you all do the exam, and let's say 50% of you will fail. Well, that means pretty much that I'm terrible instructor. That's number one. I learned that from my instructors whenever I was doing like school and college. That means I failed because I didn't deliver the message as it's supposed to be and the information.
I don't agree with that. It's not your problem if you didn't listen.
Yes, that's number two. You didn't listen. So that means now we're gonna have to flip the roles, and that gives me idea who actually cared to listen to me and who wanted to listen this stuff. And number three, well, we can go together to that and see where are the gaps, and we can go again for the same slides, maybe not exactly for the same exam, but at least go for the same slides so we can see what are we still missing to hop into that medical environment or legal environment, and you can provide the accurate interpretation. So no, you guys will no one get fired. No one get fired. This is just like we have to see what's going on and how many of you also there's that aspect of, well, do you actually care? Even if I know all the answers, but yeah, maybe the interpreter know all the technical answers, but never didn't care much about the cultural approach or the professional approach. So again, they just want to do, oh, I can just go and deliver the message and then I'm going home and I don't care about the session.
Thank you.
So that also will help us. So yes, there's a few things I want to see, especially like I said at the beginning, it's experimental. You guys are in a very huge experimental project, all of us, because I'm doing this first time, probably you're doing this first time too. So we'll see how that's gonna end eventually. Okay. All right, so yeah, we're gonna work on that. Any other questions, anyone? No, all good. All right, so where is the, let me stop. So